Hey guys, welcome to my YouTube channel. It's Nurse Gladys here and I am back with another video. And today I am not talking about pregnancy. Today my video is not directed to any pregnant woman. Let's clap for that. Guys, oh man, you guys know how passionate I am about pregnancy and midwifery, but I've decided that, you know what? Let me also target a women. Like, let me target women who are non-pregnant and do a video for them too, you know. I don't want to keep y'all out, let me bring y'all in to my channel too and do something that applies to you guys. So today, that is what I am doing. Today, I am doing a women's health related topic and I'm talking to all you ladies who are not pregnant. Yeah, so that's what today's video is about. The topic that I will be talking about in this video is, drum roll, vaginal discharges. Yep, today that is what we are talking about. We are talking about vaginal discharges. We are talking about the vagina and the stuffies that come out of the vagina. Yeah, and the reason why I thought of doing this video is because, as a woman, it's important for you to get to know your discharge. When is it normal? When is it abnormal? So that you can be able to identify any changes and be able to see when there are problems or signs of a problem or signs of an infection in your discharge, and how can you take care of yourself to ensure that you don't get any infections or any vaginal infections. So yeah, if you're a woman like me, then stick around and perhaps you'll learn a thing or two about your vaginal discharge. Okay, so firstly, what is a normal vaginal discharge, right? So as a woman, you will get to know what your discharge is normally like, right? You'll get to know your standard discharge and what it looks like, what it feels like, what it smells like. Over time, as you grow as a woman, you'll get to know what your discharge is like under normal conditions, right? You will know the color, you will know the consistency, you will know the odor that it has. And it's important to take note of that because when any of these three things that I've just mentioned, when anything changes, then you'll be able to identify that something has changed, right? So what is a normal vaginal discharge, or what's your vaginal discharge supposed to be like if it is to be considered normal, right? So when it comes to the color, it can be white or it can be watery or clear, right? Then when it comes to the consistency of a normal vaginal discharge, it should have a watery, liquidy consistency. Sometimes it will be like sort of sticky, but it shouldn't be like thick or chunky. And then when it comes to the odor, it should not smell bad. It should not have a strong smell or a strong odor, and it should not smell bad. Someone else should not be able to smell your vaginal discharge, or when you undress, you should not be able to smell your vaginal discharge. Only if you really, really trying to smell it, should you be able to smell it. But just under normal conditions, if you're passing by or you undressing, maybe to use the bathroom, someone else should not be able to smell it because the smell should not be so strong that other people can be able to smell it, right? So that's a normal vaginal discharge. So your vaginal discharge now will be affected by quite a few things. It will be affected by your hygienic habits. For example, the type of underwear that you wear. the types of soap that you use or products that you use on your intimate area down there, your vaginal discharge will be affected by whether you clean inside the vagina or outside, right? It will be also affected by your sexual habits, right? The number of sexual partners that you have, etc., etc. We'll talk about that later. And then also another thing that can actually affect your vaginal discharge is how far you are in your menstrual cycle, right? So in the menstrual cycle, it's usually like 28 to 32 days, depending on each woman. And in the first 5 to 7 days of your menstrual cycle, usually that's the time when you are having your period, right? So obviously you'll be bleeding in that time. And then as you come to the end of your period, your discharge or the blood will decrease, and then your discharge is going to be sort of like brownish, and then as time goes by it will clear. And then some of you may notice that when you are ovulating or when an egg is released in your menstrual cycle around about day 14, you'll have an increased discharge, which will be like sticky or thick, and then your discharge will vary then across the rest of the menstrual cycle. All right. So the only time you can expect to have a bloody discharge is if you are on your period, or if it's an implantation bleed and you are spotting, or if you are on contraceptives, then you might have spotting in between or bleeding in between your periods. Yeah, but that's not like really normal. Under normal conditions, it doesn't really happen unless you are on a contraceptive or you are having an implantation bleed where a baby's being formed in your stomach. Yeah, or if it's like other more serious things like bleeding due to a certain cancer or a tumor that's either in your cervix or in your uterus. Yeah, so that's the other type of discharge you can have, right? So if you want your discharge to be normal, then you need to think about these things that I've mentioned. So let me talk about the different discharges that women can have, which are considered to be abnormal. And I'll try and insert some pictures so that you can be able to see the different discharges. That's if I'll be able to find some pictures. But yeah, so the first type of abnormal vaginal discharge that I want to talk about is Candida. So that's the type of organism that causes this abnormal discharge. It's Candida albicans, and in normal terms, it's called thrush, right? When you have thrush or vaginal thrush, you'll be having this vaginal discharge that's white. But now what makes this discharge not normal is that it will be thick. It's a thick, white, curd-like discharge that almost looks like cottage cheese. That's how people usually describe it. It looks like cottage cheese. I'll insert a picture here so that you can see how it looks like. So this discharge can cause like the lips of your vagina to be red and very itchy. It causes like that very itchy, irritating sensation. It can make the walls of your vagina very red and inflamed, and this vaginal discharge can be seen like sticking to the walls of the vagina. So that's Candida. And then another one. Okay, before I get to the next abnormal discharge. So with Candida, usually you get it if you do things like douching or anything that will change the pH of your vagina. So the environment in your vagina is acidic. And if you introduce anything inside your vagina that will change the pH, maybe make it alkaline or take it close to being neutral, then it will change the bacteria. So usually it will change the bacteria or the organisms that live inside the vagina. So usually in the vagina you do have good bacteria and bad bacteria, and you also have some Candida living in there. But now if something happens to change the pH, you can start to have more oh, sorry about that. So you can start to have more of one of these organisms than you should have. So for example, if the pH of your vagina changes, maybe because you're washing inside the vagina using strong soaps, scented soaps or scented wipes, you are washing or cleaning inside the vagina or those things, you can kill the good bacteria that is normally there, that fights off all the bad bacteria and all the other bad stuff from coming in. Then now you'll have an overgrowth of all the bad stuff, or you'll have an overgrowth of the Candida, which is usually there, but it's not supposed to be over a certain limit. But now, because you've changed the environment, then Candida will overgrow, right? So then that's how you can have this bacteria. And then, so with Candida, it can happen to anyone, whether you are sexually active or non-sexually active. You can get this Candida or thrush, vaginal thrush, right? Then the second thing that you can have, or the second abnormal discharge, it's a thin grayish creamish discharge that's fishy smelling, that has a fishy odor. It smells bad, it has this foul odor, foul and fishy odor. So this one is caused by bacterial vaginosis, and this one, it's basically inflammation of the vagina, and it's also caused by something similar to what causes vaginal thrush, when the environment in your vagina is changed, either because of the soaps that you are using or the products that are scented that kill the good bacteria that's in the vagina, or this one can also now be caused by a sexually transmitted infection, where you're having bad bacteria being introduced into the vagina and overcrowding and taking the place of all the good bacteria, then causes inflammation of your vaginal walls. This discharge can also be seen to stick on the walls of the vagina. Yeah, so we also don't want to have that kind of discharge, right? Then now you can also have a greenish yellowish discharge. So your discharge can either be green or yellow, and it smells bad and it causes pain when you urinate, and it can also cause you to have pain in your lower abdomen. So what causes this type of discharge is usually sexually transmitted infections, and you are at risk of having sexually transmitted infections with the increased number of sexual partners that you have, right? Because if you have a lot of sexual partners, that increases the risk of you being with someone that caught the virus from someone else and then they give it to you, or the bacteria from someone else and they give it to you. So the more sexual partners you have, the more at risk you are of getting this yellow or green vaginal discharge. So the organisms that cause this type of discharge is your chlamydia, your gonorrhea, or your trichomonas vaginalis. So those are the organisms, and they can change your discharge in this way. And these are very dangerous, because if you have a sexually transmitted infection and it's not treated, if you get pregnant, it can cause you to give birth prematurely and have a low birth weight baby. It can cause you to get a miscarriage if it's early on in the pregnancy. If you are not pregnant, the infection can go up from your vagina into your uterus and into your fallopian tubes, causing scarring of that tissue, leading you to become infertile. Or if there's scarring of those tissues, then you can also end up having an ectopic pregnancy. Yeah, so those are the complications that vaginal untreated vaginal STIs can cause. So it's very, very important to ensure that you are in a monogamous relationship with one person, preferably in a committed relationship, in marriage, for example, where you know that you are faithful to your partner and your partner is faithful to you, and they are not seeing any other people or having sexual relations with anyone else besides you. So yeah, ladies, that's what I wanted to talk about today. That take care of yourselves. And ladies, another thing that you need to keep in mind is that if you are starting to have funny, abnormal discharges that you are not used to, that have a different color to what you are used to, that smell different, have a strong smell, and your vaginal discharge has become increased, it's coming out a lot to the point that you have to be wearing panty liners and yeah, all of that jazz. If you notice that you are having an abnormal vaginal discharge, and if it really happens that you do have an infection, you having an STI, you having a discharge that is different because you have an STI, for example, gonorrhea or chlamydia or trichomonas, the fact that you can have that STI which will affect your discharge, it means that you can also be at risk of getting other STIs like HIV, like genital warts, like herpes, syphilis. So if you start to have vaginal infections, sexually transmitted infections that change your vaginal discharge, it means that you are also at risk of having other infections like your HIV. So it's very important to protect yourself. Um, I can't stress this enough. I really can't stress this enough. If you start seeing that you are having a different discharge and you know that you are faithful to your one partner, you need to ask yourself, are they faithful to you as well? Because your vaginal discharge is not supposed to be smelling bad. It's not supposed to be different from what you're used to. So it's very, very important for you to always be on the lookout of that. Yeah. And your vaginal discharge won't just change out of the blue. It won't just change out of the blue. Usually something must have happened for it to change. And you don't just get an infection just out of the blue. An infection, you get it from someone else. So that's also very important, ladies. In terms of washing your vagina, you don't need to use anything inside your vagina. Your vagina is completely capable of keeping itself clean. You don't need to put any soap inside. You don't need to put any products inside your vagina to clean it, or any wipes or anything like that. When you are washing, just clean the outside of your vulva and your vagina, but never introduce anything inside the vagina. And wear cotton underwear so that your vagina can breathe. There can be airflow down there. And make sure that that area is not moist. It's always dry and not moist. That's why you need to wear breathable underwear, preferably cotton underwear, so that there can be that airflow in and out of your vagina. And then, yeah, you don't need to use any intimate wipes, because your vagina actually, it has a certain smell, and that smell, you will know that smell, and it's not supposed to smell bad. It's not supposed to be a bad smell or a strong smell. Once there is a bad smell or a strong smell, you need to ask yourself, what is the problem? Could it be that you are having an abnormal vaginal discharge that you need to go and get checked out? So yeah, that's what I wanted to talk about today. Take care of yourself, ladies. Please don't forget to subscribe to my channel, like this video, give it a thumbs up, share, and do all the you know the drill, guys. Please, I'm on the road to 1,000 subscribers. Actually, not 1,000. I'm on the road to 500 subscribers right now. So please subscribe to my channel, guys, and watch my content. Please watch my whole videos, because so that you can get the full scope, you know, of everything if you watch the whole video. But yeah, this is me. I'll see you guys on the next video, and ciao ciao ciao, bye.